Is the pitch clock leading to some serious arm injuries to pitchers in Major League Baseball, or is it just something that's been happening over the years because of how high the velocity is right now in the game? Arm angles, the grip on the baseballs, different things. Is it that, or is it the pitch clock? And, of course, when we have questions dealing with injuries, we go to the one and only, the leading expert, our guy, Dr. Jeffrey Sellman, joining us on the line right now, Florida Orthopaedic Institute. Dr. Sellman, how you doing?
I'm doing great. Nothing like to start the hump day with you guys in the morning.
That's exactly right. That's why we wanted you on, especially on a Wednesday. We have heard from different players, Garrett Cole. We've heard from our own Pete Fairbanks, bringing up the pitch clock and maybe having to contribute to the slew of injuries we're seeing. And then we're hearing other orthopedic surgeons saying, well, maybe it's something else. Maybe it's happening at a younger age, youth baseball. We go to our top guy, the top leading orthopedic surgeon for us and really anywhere around, Dr. Sellman. What say you with the recent injuries we're seeing in Major League Baseball?
I think it is a definite combination of multiple different things, but I'm going to go on the camp of what we're doing to these guys in Little League Baseball, the travel teams combined with high school teams, not getting enough rest for that arm in the early years. And that's why we've been seeing more Tommy John earlier in their careers than we did back in the 80s and 90s.
Yeah, and we've talked a lot about that with our friend Doug Wechter when he's here, and a lot of people definitely believe that, starting kids out too young throwing the baseball is part of it. I'm kind of curious what people can do. Aaron had just brought up the other day the fact that apparently the ligament that has to be operated on when you have Tommy John surgery, that doesn't actually mature until you're 26 years old. So knowing that obviously teams want to invest and have players much younger than that, what could be done other than just a lot more rest in between pitching for young players to avoid this? Should they only pitch a couple innings? Is there something in your opinion that could be done to maybe slow the curve of what's going on here?
I think what could be helpful from a parents and coaches perspective is not truly not pushing this multiple, just one sport all year round. The top players of all professional sports played multiple sports to give their growing bodies a chance to do something else. Even though they may be active with a different sport, your muscles are doing different things, and everybody's muscles mature a little differently. So one kid who can throw so much, the other kid cannot. So, we really need to think about that.
When it comes to the pitch clock, Dr. Sellman, what do you think that could be doing? I mean, I personally don't think it's, and like you said, you think it's happening more in youth baseball, but could there be an argument to be made about the pitch clock having an impact on anything in the game, whether it be injuries or anything else?
Personally, watching the game as a fan, it makes the game a little bit more enjoyable to get that thing going a little bit more quickly.
Oh, yeah.
Thinking about it, and they're not as much rest in between pitches anymore. I think that might be a good thing to keep those muscles still a little bit active. But, boy, the velocity has certainly stayed up there for several years, and I think that also contributes as well.
So you actually think that, and I kind of said this, but it might be a benefit for pitchers to have to use a pitch clock as opposed to a detriment to their health.
Right. No clinical research to support that, but I just from a muscle physiology standpoint, it would make sense to me.
With the grip and the tack that was used last year, how much, when you're talking about the grip, how important is that, and what type of injuries could you see if you're having trouble gripping the baseball?
Yeah, the interesting thing about the grip is that a lot of these injuries are actually related to the wrist and also the core, not as much to the elbow or shoulder when we're seeing these elbows and shoulder injuries. So the grip has a lot to do with it, how the position of the wrist is around the ball as you're going through that torque phase of the follow-through phase of the throw.
I want to get into our friend Mikhail Sergachev, who, of course, returned to practice the other day for the Tampa Bay Lightning. Of course, a red jersey, not able to have contact yet, and certainly not imminent, his return. But, when I first texted you when his injury happened, you said his season was probably over, at least certainly the regular season, and you said if he were able to come back, it would have to be because the Lightning made a deep playoff run. We're all hopeful with the way they've been playing recently that might just be the case. But I'm curious, when you see that he has returned to practice, again, obviously not having contact, wearing that red jersey, but having him return to practice, does that at all encourage you? Does that at all change your mindset when it comes to the time frame? Could we potentially see him in the playoffs earlier than maybe you expected when the injury first happened?
So, yes, we can definitely potentially see him in the playoffs, still deep. And I know Coach Cooper is kind of tiptoeing around it and definitely not going to have him in the first round, which is very smart.
Yeah.
With these kind of injuries, it's like this up and down garbage that, all of us hate. But, he's still human, a little bit superhuman than all of us. But he's going to have these good days and bad days. But it's definitely encouraging to see him out there skating around and being back with the team.
What is it about this kind of, you say it's very up and down, the recovery. What is it about this kind of injury that makes it, I don't know if it's more difficult to recover from but makes it kind of, a bit of a roller coaster recovery?
We think of course, he had two injuries, the fibula and the tibia, and then he had hardware placed. So we're like, well, great. Of course, the hardware's there. It should be stronger. But not only does the bone need to heal, but of course, the muscle and tendons around it and the time off is a little bit difficult. Those muscles, for all of us, go away quickly, and then they take a little bit longer to come back. That's the frustrating part. So as those muscles grow around the bone, it pulls on that newer bone, and you can get some pain.
We got Masters starting tomorrow at Augusta. Last week, Akshay Bhatia, he had his first a second win, actually, at the Valero Texas Open. I don't know if you saw it, but he went into a playoff. The putt he sank on 18 to force the playoff, he celebrated by throwing his arm into the air, and he hurt his shoulder by throwing his arm into the air. What are some of the weirder injuries you've ever seen?
Usually stepping on a pine cone while we're running. That's always a weird injury.
Yep.
We had
it's equivalent to a Lego outside.
Oh, yeah, that's no good. Our good friend Bill Grammatica, who's been in on the show with us a handful of times, he, of course, suffered one of the most famous and funny injuries in the history of sports when he, I think he tore an ACL jumping up, celebrating a field goal. Have you had any celebration-related injuries like that?
Yes, quite a bit. I actually bring Grammatica up a lot of it to my younger athletes when they come in with injuries and warning them about the celebratory tactics related to knee injuries. But you see a lot in baseball, too. Hitting the wall. That's always a very common thing. I usually ask them what girl did them wrong, but, it's usually not that.
FloridaOrtho.com. Make sure you check him out if you're dealing with any injuries yourself. Book that appointment today. Like Dr. Sellman, he's not the only one. They have every doctor, any injury you're dealing with, they've got the best. FloridaOrtho.com. Dr. Sellman, really appreciate you answering the call and joining us outside of our normal time during football season when we talk to you all. But thank you so much. Really appreciate it.
Yeah, it's awesome. Thank you.
Thanks, Doc. That is great. I can't wait to tell Bill Grammatica that he is a cautionary tale for patients at Florida Orthopaedic Institute.
What, you think Bill doesn't know that? Come on. Of course Bill knows he's a cautionary tale. One of the strangest injuries ever.